Hey you guys, welcome back. So this video is going to be a little bit different. It's going to be a what they don't tell you about pregnancy video. And so far the only things I've experienced have been horrible. So I really wanted to tell you guys so that if you experience them, you'll know you're not alone. Because one of the things that I had no idea about. So yes, let's jump right in. Let's not jump right in. If you don't want to see a video that's TMI, I'm going to be talking about TMI pregnancy stuff. If you are not interested in seeing it, if you're going to be disgusted, if you're going to be like, she nasty, then you should probably turn the video off, because the point of the video is to help someone else who might experience this and had no idea about it. They could get it or what it is. So all right, so you watching, we watching. Okay, so the first thing I want to talk about is hemorrhoids. Hemorrhoids are very common, but I've never had hemorrhoids before. And if you follow my journey, you know that I have a 12-year-old and a 9-year-old. And with both pregnancies, I did not have hemorrhoids. So yeah, and I'm not all the way at my 9th month yet. And so it's kind of surprising to me that I already have them. I thought, I would get them during delivery when, I'm straining and I'm pushing out the baby. But, unfortunately, I have them right now. I've started them, at 28 weeks. So at 28 weeks, they came out and they're horrible. If you don't know what a hemorrhoid is, it is basically a varicose vein, which is the vein that's in your bottom. And it's because of the pressure or the straining that the baby puts on you, or during delivery, you'll push out one of your veins out of your bottom. And really, honestly, it just feels like it's near your butt, and it just feels like a little bubble almost, is what it feels like to me. So to treat that, I am taking suppositories, which releases like some medicine. Like, it's very soft. I actually have to put those in the freezer because it's so soft and my nails are so long, it gets caught up in my nails and I can't push it in. And it releases a medicine that is supposed to soothe and constrict the blood vessels so that they go back down. So I do that about once a day. I'll do the suppository. I will also do Miralax, so that I'm not straining to go to the bathroom, because if you strain, that does make it worse. And I'm also taking a stool softener that will help as well. I will actually be taking the stool softener the remainder of the pregnancy, because I know my hemorrhoids not going to go away until after I deliver. So, and I'm gonna stop saying promise. So I want to keep taking the stool softener just so that, I could continue to use the bathroom. And if it's a softer bowel movement, that's fine with me, as long as I don't have to strain. I don't want to get constipated again. When you get to your 8th, 9th month, the baby's growing so big, they'll put pressure on your intestines, which will bring back the constipation that you had all the way at the beginning of the pregnancy. So I don't want to do that. I will be taking the stool softener the rest of the pregnancy. So that should help out. So hemorrhoids are very common. If you get them, you can use Tux. I do have Tux, and it's basic. You can get them at your local CVS or Walmart, and it's a little round pad, and it's drenched in witch hazel, and it is an astringent. So when you go to put it on your bottom, it will burn a little teeny tiny bit, but in comparison to how the hemorrhoid feel, it will feel like 1,000 times better. That helps. An ice pack will help. If you sit down a lot, try to get up and move. If you stand up a lot, try to sit down and rest a little bit. Always make sure you're sitting on something soft. I have an extra very thick pillow right here that I'm sitting on. And also they say a warm bath. It actually helps a lot. Like in the beginning when I first got it, I was taking baths every day, because it just helps. It just feels a lot better. And then getting in the pool, because the baby will feel weightless, and so it'll take the pressure off of your lower extremities and your veins and all that good stuff. So if you get hemorrhoids, those are a few things that can help. And just because you've had a baby before and you're a pro at pregnancy and delivery, don't mean that with the next one you won't get it. Because like I said, this is the third pregnancy that I'm, pretty much all the way full term with, the third one. And so I've never had them in pregnancy. So every pregnancy is different. The next thing I want to talk to you guys about is yeast infections. Didn't nobody tell me that I could get yeast infections so much while being pregnant. Like, I've had a yeast infection before, but I didn't think that I would get them as much as I have being pregnant. And it seems like I'm a magnet for yeast infections now that I'm pregnant. I'm 30 weeks in a couple days, and I've had about 4 or 5 yeast infections since I've been pregnant, from the beginning of pregnancy up until now. Over the holiday weekend, what was that, Memorial Day? I think it was Memorial Day we just had. I think it was. I don't remember the holiday. The holiday we just had, I was going to claw off my vagina. It was so itchy. It was so burny. It was so discharging. It woke me up out of my sleep. I couldn't fall asleep. It was horrible. I ended up using the Monistat 1-day treatment. You can use it, although going to the doctor and getting the one pill that you take is way better. The doctors, they were closed. I would have had to go to the emergency room, and I ain't got time to be sitting in nobody's emergency room, so I just ran to the store and grabbed the 1-day treatment. It took about 2 days to fully work. Before I did that, I was using ice pack. I was constantly wiping, and I had switched over to wet wipes because I didn't want to use tissue. It was sore to wipe, so I could barely wipe it to begin with, let alone using dry, hard tissue. I was using Vagisil for the itching, and I just couldn't take it anymore, and I knew exactly what it was because, like I said, I've had them before. So I just went and bought a 1-day treatment, and I did call my doctor on Tuesday because that's when the clinic had opened back up, and I let him know, hey, the yeast infection had came back, and I treated myself, because if I wasn't, I was gonna claw off my vagina. And he thought it was so funny. He was like, that's fine, you could use it, let's just wait it out a couple of days and make sure everything clears up. And it has. I'm completely fine. But that's very common in pregnancy too. So if you get it and you don't have time to get to the doctor, make sure that you know that's what it is. I know that's what it is because I get them so often now. But if you don't know what it is, definitely go to the doctor. Don't try to treat yourself and you're not sure if that's what it is, because it could be anything else. So make sure you're treating yourself for the right thing. But if you know that's what it is, then go ahead and treat it and make sure that you're keeping it clean and you're keeping it dry, because that's where yeast grows, in wet, dark, hot places. And the other thing I wanted to talk to you guys about that I had no idea about at all was varicose veins in the vagina. So I have this book that I got from my doctor's office, and it's his book. I just read it, and I was like, what is this? This is interesting. So I asked him if I could borrow it, and he said yes, but if I don't bring it back, I'm not getting epidural. So I will be taking this with me to the labor and delivery. Like, here, Dr. Smith, here you go. So basically, I'm going to read this little passage to you. It says, this little paragraph. The weight of your uterus pressing down on major veins called the inferior vena cava can slow blood flow moving from lower body to your heart. The results may be sore, itchy, blue bulges on your legs called varicose veins. These veins can also appear near your vagina, valvular, and rectum. In most cases, varicose veins do not cause significant problems, but are more cosmetic issues. Varicose veins are more likely to occur if this isn't your first pregnancy. They also tend to run in the family. There's nothing you can do to prevent varicose veins. There's nothing I can do. So unfortunately, I was the one who got it in the rectum, which is known as a hemorrhoid, and I got them in the vagina. So I have varicose veins in my vagina. Fun. And when I feel down there, I can feel the vein. Like I can feel the veins. It feels like a rope. And you can just feel it. If you rub your hand down there, you can feel it. It's they're under control now, but when I first had them, I didn't know what was going on. But now I am taking my stool softeners. That helps because it relieves the pressure from my intestines. I am laying down a lot more. I was trying to like keep up with the house and keep up with the kids and make sure I give my husband time and cook dinner. I lay down a lot more now, so I'm not sitting straight, so all the pressure's not going down. I use ice pack. I use my Tux, which is the witch hazel. If you don't have Tux, you can always just run to like Walmart or CVS and get witch hazel and put it on a cotton ball or a piece of tissue and just dab there. You can swim. Swimming makes the baby feel weightless, and so it takes the pressure off of your lower extremities. Yeah, so all that stuff did help, and it has gone down a lot. I think now that I know what it is and I know how to manage it, it's a lot better. I can work still. Like if I'm sitting down too long and I get uncomfortable, I'll get up and I'll walk around and I'll move. I'll take a warm bath. That helps a whole lot. And in order to submerge my stomach in the water, I have to lay on my side so that, you know, she kind of does feel a little weightless in there. And so those things are things that I never knew that was frequent in pregnancy. And of course, because this is not my first or my second baby, I guess that's why I have the varicose veins in both places. So I got it double trouble. And that's really what I wanted to come and tell you guys. If you do get those things, you're not alone. Other women have them. They might not just talk about them because they are gross to talk about. But those are the ways that you can alleviate the pain. If you guys have any questions or want to know anything else, you know you can comment. You know you can send me a message. I'm an open book. I want to be helpful to somebody else. And I hope I am. So I will talk to you guys later. I am going to come and give you guys a pregnancy update because I'm now like 30 weeks and 3 or 4 days. And so I'm almost to the finish line. I really appreciate you ladies watching and supporting me. And I am watching you guys back. Trust and believe. I'm on it. And I love you guys. Bye.